Stuti Pathak and you're watching my channel. So today I will talk about sleep apnea. Okay, so this is a very fresh topic, very new topic, and this is very much related to your health because if you are not sleeping well, so obviously your sleep will disturbed and you will not feel healthy. So let's get started with this particular presentation. So, what is basically sleep apnea? So, sleep apnea is a serious sleep disorder that happens when your breathing stops and starts while you are asleep. If it goes untreated, it can cause loud snoring, daytime tiredness, or more serious problems like heart trouble or high blood pressure. So, this basically means that there's an irregular breathing which happens during the sleep. Sometimes your breathing stops, sometimes your breathing gets started. So, this is something which is a very uh, difficult for a person who is having this particular disorder because it can lead to a lot of problems also like high blood pressure and some kind of heart trouble as well. Okay, let's see more in this particular presentation. So there are different types of sleep apnea. Okay, so there are three types of sleep apnea. One is obstructive sleep apnea, second one is central sleep apnea, and third one is mixed complex sleep apnea. So let's discuss what these three types of sleep apnea are. So obstructive sleep apnea. So obstructive sleep apnea, which is the more common form that occurs when throat muscles relax and block the flow of air into the lungs. So this is basically happening because of the poor air passage, okay, from your mouth to your lungs. So this is obstructive sleep apnea, which is causing obstruction. Now comes the central sleep apnea. Central sleep apnea, which occurs when the brain doesn't send proper signals to the muscles that control breathing. So, for example, if your brain is not very well trained in sending the signals which causes breathing, so it leads to central sleep apnea. Now comes the mixed complex sleep apnea. So, treatment emergent central sleep apnea, also known as complex sleep apnea, which happens when someone has OSA, which is the obstructive sleep apnea, diagnosed with a sleep study that converts into central sleep apnea when receiving the therapy for obstructive sleep apnea. So, this is a very complex and mixed kind of sleep apnea wherein initially the patient has obstructive sleep apnea, but over the period of time, due to therapy or medications, the person starts having a central sleep apnea. Now let's know that what are the sleep apnea risk factors. So the smoking, old age, overweight and alcohol absorptions are the most common factors of sleep apnea. What happens in the smoking as well, it basically obstructs your air from flowing into the lungs, and that is causing sleep apnea. And as you get older and older, your breathing mechanism gets very poor, so that's why you also get sleep apnea. Now overweight is one of the reasons of sleep apnea because um, when you eat a lot of food, your food basically causes obstruction in the breathing airways, so it is very important for you to eat less food. And alcohol assumption is also one of the factors which causes the sleep apnea. Now the symptoms are loud snoring. So if you're snoring very loudly, so obviously you have sleep apnea. Morning headache, irritability, then gasping for air during sleep, awakening with a dry mouth, difficulty staying asleep. Okay, now what is the treatment of this particular problem? Self care. So physical exercise and weight loss is very important. So as we have seen the risk factors as well, if you are an overweight person and if you don't do exercise, then it is very important for you to do physical exercise. At least you should do physical exercise for about like 150 minutes per week, that is 30 minutes per day, 5 times a week. Okay, Then comes the supportive care, so continuous positive air pressure and air management. So this is basically a breathing machine which is being used so that there's a positive airway pressure which is being, uh, made into the airways of the patient. And air management has to be done by, removing all the dusts, food, and all the food items, or uh, anything which is obstructing the airflow. So first one is the machine, the continuous positive airway pressure. That is the machine which is helping in the breathing, and it basically cleans the breathing airways. And air management is when you stop eating or inhaling something which is not uh, causing the smooth flow of air into your lungs. Then comes the surgery, tonsillectomy and paratoplasty. So these are the surgeries wherein in tonsillectomy, wherein you remove the tonsils, and it helps in the smooth flow of breathing. And paratoplasty is basically you are removing palate in your mouth. Okay, so these are the treatments for the sleep apnea. So I hope you really like this video. Please don't forget to like, share, subscribe my channel, and I will be back again with more types of information related to health. Thank you so much. Stay safe and healthy.